Hello and welcome. This is Health and Wellbeing, and I am Lois Abasambu. Our health, they say, is our wealth, as the quality of our health determines the quality of our life. And this makes it imperative that we safeguard our healthcare infrastructure and personnel. With Nigeria's already struggling healthcare system, another menace contributing to the degenerating level of healthcare is incessant attacks on health facilities and personnel. Well, it is in this light that the Nigerian Red Cross Society began the Healthcare in Danger initiative to sensitize individuals of the importance to safeguarding our healthcare infrastructure and personnel. Today on the program, our guests are Mr. Anthony Dominic Akwanuko, who is the Health Coordinator of the Nigerian Red Cross Society FCT Abuja branch, and Ms. Joy Mwabani, the Communication Coordinator of the Nigerian Red Cross Society FCT Abuja branch. You're all welcome.
Thank you.
And it's nice having you here, Mr. Akwan and Ms. Joy.
Thank you very much.
Well, now going straight to discussion on ground, talking about healthcare in danger. What brought about this initiative?
Okay, basically, the Nigerian Red Cross have fundamental principles, and which is humanity, impartiality, neutrality, independence, voluntary service, unity, universality. So we're into and we're very keen on voluntary service and helping people, the most vulnerable in the society. So if, for instance, this is the mindset of our healthcare personnel, there is an expectation that, okay, I'm giving out my best, I'm doing everything I can to actually help people, to actually make sure that people stay in good health, and Nigerians are actually satisfied. They deserve to be protected. Some of our healthcare and volunteers and personnel are being violated and having some level of violence, even in duty, in the course of doing their work on duty, and it's really, really like not so encouraging for such. So that's actually prompted this, where everybody can actually have the freedom and the allowance to actually be themselves, to actually genuinely volunteer. Do you understand? With impartiality. Nobody goes out there, a healthcare person go out there and, in fact, it's against our principles at Nigerian Red Cross to actually get out there and you're trying to be impartial or pick or select certain people probably because of their religion or tribe. Or no, we don't do that. We're very impartial, we're voluntary, we're out there for everybody and anybody.
So, Mr. Anthony, there are basically quite a number of things that have happened, incidences that would most definitely might have birthed this initiative. What are some of these things, the incidences that have happened?
Okay, just like she had said, thank you very much for your question. It is born out of passion for humanity. Whatever Nigerian Red Cross is doing across the globe is because of humanity. There are incidences whereby doctors are abducted. There are some maybe nurses assault everywhere. The ambulances, the facilities are being looted in the hospital sectors and everything. There are some vandals that are taking place. So it is on this light that we come up as Nigerian Red Crossers. How do we help this? Already, a lot of people are suffering out there because we are grassroots workers. We go into the rural areas. You see a lot of people, the vulnerable ones, they are suffering, accessing good and quality healthcare system. So because we go in there, we now come up with an exercise, healthcare in danger. How do we salvage the situation of the health sector so that we can preserve where they will go and take medication? Health facilities are where we go in, get treated, get medication, get well. So if we do not take charge, if we do not protect the place, the personnel, the facilities, then the populace will suffer.
So basically, I feel in health, international health law, most times when, or even international law, most times when there are crises, most especially armed crises and violence, hospitals are not supposed to be attacked, churches are not supposed to be attacked, mosques are not supposed to be attacked, schools are also not supposed to be attacked.
You're correct.
But with most especially in this part of the world, and now when I'm talking about this part of the world, I'm talking about Nigeria and Africa, we have seen attacks on communities, and hospitals are being attacked, schools are being attacked, worship places are being attacked. What could be the reason behind this, and what could be done to see that these issues are mitigated?
Well, it boils down to behavioral change. Just like you said, it's stated. Hospitals, mosques, Christian centers, and all these places you've mentioned, they were not supposed to be attacked, yes. But a lot of things happen along the line, and people go in and start attacking these systems. It is behavioral change. That is why we are here. We are out here to tell the world, hospitals, facilities, health personnel, please, we should safeguard them. If there are no doctors to save us, to treat us, then we cannot get well. That is why in this light, Nigerian Red Cross has come up and said, okay, let us come with this massive awareness. It's not only here on the media, we're going out to schools, to marketplaces, to churches, to communities, to talk to the minds of people. Please, can we safeguard the facilities, the ambulances, the personnel, so that we can have a way of getting back there, get our medications, get treated on any sickness that may have come up.
So, Ms. Joy, which areas would you say should be prioritized in preventing violence against healthcare, and that's healthcare infrastructure and also healthcare personnel, most especially when it comes to cases of crisis and violence?
The personnel, first and foremost, should be preserved. In order of priority, the personnel, the facilities, every stakeholder. In fact, we all are all stakeholders of this, because it's not about just a certain people. It's about everybody. If everybody have this consciousness that these persons are independent of any sort of influence or independent of this issue, they are here for our good. If there's anything that is going on, both the hoodlums, both the police, both the road safety, everybody who is a stakeholder on ground, and even the populace, the people know that these people are for us. Do you understand? They will safeguard this place. So if anything that happens, any casualty or victims or anything like that, you know that these people are actually standing for us. So in order of priority, the personnel should be preserved. We should know that these people are there for us. They are there to, they have the know-how, the technical know-how, they have the knowledge. If something happens now and you are there, you're looking at the situation, you don't know what to do, how do you, these people are people that actually know. And that's how we get people who just lose their lives for no just cause, for something very minute that would have salvaged or maybe managed properly. So firstly, the health personnel, then the facilities, the ambulances, the whole place, the hospitals. Something is happening, you are going to lose the hospital. It might even be your mother who can be attacked. What do we do? Because this place now is do you get what I'm trying to say? So it's actually turning, it's like a loop, it's going round. So everybody actually have to put hands in on deck. The personnel should be preserved, the ambulances should be preserved, the facilities should be preserved, the stakeholders, everybody that are working hand in hand should be preserved to ensure that we bring safety at every given point in time to the Nigerian people.
So I see that the Nigerian Red Cross is putting in, most especially as it comes to sensitization. I think this would go to Mr. Anthony, to sensitization. But apart from sensitization, what other practical things is the Red Cross doing? So let's take, for example, when we're talking about preservation and we're talking about crisis, when there is a crisis, when there is violence, I don't think that's the time for you to stand and tell people, stop, don't come to the hospital, don't attack the hospital. At those times, what should be done? Do we need extra security? What should be done? What practical things should be done to make sure that the healthcare personnel and the facility generally is protected?
Okay, thank you very much. First and foremost, I want to clear this air. Nigerian Red Cross is not a force implementing agency.
Most definitely.
It's not. We are only trying all our possible best to speak to the minds of people, the minds of Nigerian stakeholders, everybody, so that in anything that happens, people with their own consciousness will know that these places need to be preserved. And we need to prioritize casualties. Prioritize casualties in the sense that, just like you said, in any time of conflict or violence, you see an ambulance coming in with an emergency situation with a casualty. Maybe there are some roadblocks. Maybe you go to the hospital, they'll demand some, go and open card. They'll tell you, I'm not saying all those are wrong or bad. They'll tell you, okay, pay so and so before we start treatment. The first thing is to prioritize casualty and emergency. Can we save life first? Okay, these things have happened. Okay, let's first save this life. Other things can come in. Are we together? So we continue to speak to government, legislatures, national, state, local, all folks of life, stakeholders, relevant, even the youths. Everybody in the community are in, all hands should be on deck, because the health sector is for all. Nobody on earth will not tell me it doesn't fall sick. If you don't, if it affects your family members, you're affected. So we all have to be concerned, everybody. So the best we could do, we keep talking to the minds of people. Like I said, not only here is just to amplify, we're going down. The program is a maiden one, though. We're still going down to the motor parks, the churches, mosques, every area, so that we can tell the people to change their mindset towards the health sector, the personnel, and then preserve and safeguard the place.
Now, you spoke about legislation.
Okay.
And one of the major things that actually helps things to be done fast in a country is making sure that whatever decisions will be made are backed by legislations. And like you said earlier, in fact, you just brought it back to my mind. The National Assembly has actually passed when it comes to gunshot wounds. We always had this issue of when someone had a gunshot wound and he went to the hospital. One of the issues was you had to go and bring a police report.
Extract.
Yes, and then bringing a police report. We have lost quite a number of people because before they're able to get the police reports, the bureaucracy tied around that and all of these things has been an issue. So we have lost quite a number of people because of that. And there has actually been legislation that should not be the procedure, but it hasn't changed. So what can be done to make sure that these legislations are made stronger and implemented? Do you understand? Because if someone has, take for example, he has been attacked by armed robbers and has been shot, rushed to the hospital, and we're asking for a police report. Before we go to the police, get all those things done, come back, and all of these things, before you know it, this person is losing blood, this person is, sometimes, sadly, we lose these people. And it's not because legislation has not been put in place. It has been put in place. So as a CSO, the Red Cross, what can be done, or what is the Red Cross and other CSOs, if you are working with actually CSOs, what are they doing to make sure that these legislations are actually implemented in hospitals?
Okay. Right on this project, we are already having plans to do a program with stakeholders, which will include the people like both the police, the road safety, the fire service, like every stakeholder that would normally work hand in hand with on field and in every intervention otherwise. And the reason why we do this is that this consciousness is in everybody. It's when someone's mindset is changed over a particular thing and the person's behavioral actions, and it's not just doing it because it's an act or it's a policy, but then this is something that I understand that it's for us. Do you get? So now, first of all, that's why we're doing sensitization. That's why we're here. So we're doing this to not just to only the Nigerian people, like the populace, people watching us or listening to us right now. Like my colleague mentioned earlier, we're taking it down to the grassroots. We're having times when we'll have a gathering, we'll have a meeting, like a workshop with these stakeholders, where we will sit down and discuss issues like this. Do you understand? Come to a resolve. This is why we're not working alone. We don't intend to. We can't push this thing. We can't drive this thing down alone. We can't do it alone. That's why we're doing this sensitization. We're not a law enforcement agency that will say you must do this. This is how it should be done. No, but we are actually trying to appeal to people. We're appealing to their emotions. We're appealing to their understanding that this is how it should be. What do you think? If it's your sister, if it's your mother, we have situations. We are actually examining our past experiences. Do you get? So we're actually doing all this together. That's why we're here. That's why we're going out to the field, into the communities to talk to people, the young ones. That's why we're also meeting with our stakeholders, where we'll be represented, cut across the local government areas around Abuja. We're going to be having Amak 1, Amak 2, Buhari, even Ogolada Kwali. We're going to be having that gathering where everybody will gather together, represented from different agencies, unless, of course, we're on it. We have to do this together.
Yeah, we definitely have to do this together, because our health, like I say, is our wealth.
Yes.
The quality of our health determines how wealthy we are.
Of course.
No matter the amount of money you have, if your health is not good and secure, then you're almost like a poor person. But we're going to go on a short break, and when we return, we're going to talk more on what can be done or what we can do as individuals to make sure that we safeguard our health. Do stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803-705-1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department.
Sir, can you please give us the permission to search you? You can go.
Is this a movie? If it happened...
Officer, I beg carry and go station. When our Oga come, you come meet am for there.
Hey, Mr. Man, I cannot do that.
Tell your Oga to come to our station when he returns.
Am I in a movie? If it happen,
Mama, please. Mama, please.
Thank God you're here. Do the needful.
Mama, please, just 3 weeks
Madam,
now.
why did you invite us to come help chase your tenant now?
This is a civil matter now.
Is this a movie? If it happen,
If we follow
The new police law.
Welcome back, and thank you for staying with us. This is still Health and Wellbeing on ASO Television. Before we went on the break, I've been here with some officers of the Nigerian Red Cross Society, and we've been talking about safeguarding the healthcare of our nation, most especially when it comes to cases of violence and crisis, and generally our healthcare system and our healthcare personnel. And before we went on the break, we spoke on legislations that could be used to back whatever it is that would help to safeguard our healthcare systems. And Mr. Anthony,
Yes.
so before we went on the break, we were talking with Ms. Joy on safeguarding our healthcare systems and using legislation to make it stronger and make sure that they're implemented. What more can you add to this?
Okay, I quickly want to say this. One of the fundamental principles of Nigerian Red Cross We don't take part in government and decisions. We don't interfere. Independence. We are independent, working on our own, but we are open to public hearing. We are open to public hearing. We can be invited to government. We can give suggestions, suggestions, and create awareness. So there is this act that is already on ground, Accident Victim Act. Now, the legislature have promulgated these laws. They are already there, just like you said, that these laws are there. But they need to be strengthened. Because just like you said, somebody goes in with an emergency into the hospital, be it private, be it government hospital. The first thing that should be done, please treat. That's the first thing that should be done. Let's save the life first. So there is need to strengthen the Accident Victim Act. And the legislation should promulgate policies that will help to strengthen the life of the vulnerable ones. Are we together? So we'll encourage them who can go to advocacy to the government, who can go create awareness to the legislature, national, state, primary, or what have you, so that we tell them about these things. Let them be strengthened. They're already there. Let them be strengthened. And then I want to add also, let the legislature also provide or preposition medicines, drugs, in some hospitals so that it could be easily accessed. I quite understand that this hospital, they use money to buy these medicines. Oh yes, some run private, some in government. It is money they use in running them. But if the legislature or any government agency would say, okay, for the sake of accidents and emergencies, can we preposition medicines and drugs in strategic hospitals and places so that as soon as you come in with an emergency, the first aid treatment can be done to salvage life. There is very thin difference between life, when there is an accident situation, life and death. The few minutes you rush this person to the hospital, you can save life. And as you rush this person to the hospital, then there is already prepositioned medicines and drugs and things that can help, drips and dextrosaline and what have you. It can go a long way. So we want to appeal to the legislature, the government agencies, preposition drugs and medicines in strategic hospital. Then the law should be strengthened. Should anyone come with an accident or what have you, let's get treated. I've been on the field for a long time. I personally went on a journey, personal journey. This is private. It was in the night, about 11 in the evening on the night. There was an accident. I had to stop by. Nobody asked me that. That's the voluntary work I signed. I stopped by and I helped. About 3, 4 sustained great injury. One was on the head. So what am I supposed to do? At that point, I'm the only Red Crosser that is there. Use the passerby, the people ganging up. Just tell this person, control this traffic. Tell this person, stand here. So that we don't have any other oncoming vehicle crashing in on us. Now, can you help? Rush this one to Metema Hospital, rush this one to this hospital. Just involve them. And as they are going, some of them told me, bros, they are afraid. They won't go now, they will say they are the one that hits these people and then come in. So am I supposed to split myself in 10 places and say, okay, I'm going with you because of my ID card or my Red Cross beep? So these are some of the things we should tell the government to strengthen. Promulgate laws. Talk to the hospital management board. Let them awaken this act. Keep strategic medicines for strategic hospital. Let them be accessible. This can fight the menace of healthcare in danger.
Thank you very much, Mr. Anthony. And speaking about being on the field, one can only imagine things you see when you find yourself on the field. Quite a number, and you just gave us one experience of yours. But Ms. Joy, being on the field also, because obviously you're always on the field as well. But and you interact with people one-on-one, most definitely. What would you advise individuals to do? What would be their place, or what would be our contribution as individuals and just normal citizens in making sure that we safeguard our healthcare facilities and our personnel?
Okay. What we can do as individuals is support. Support them, protect them. if you see healthcare personnel out there, you see volunteers out there, you see doctors and nurses out there, and they are trying to help, you can support them, because sometimes we can't do it on our own. Like he was painting a picture for you here of how he had to split the crowd and do this, do this, do this. Yeah, there are times when you get to scenarios where only you cannot control blood, only you cannot control, mobilize a fracture, only you cannot be stopping, trying to help someone who is unconscious. You cannot be doing all that at the same time. But in order of priority, if you start with this person who is unconscious and people are willing to help, time is running, the casualties are many, you can always tell people what to do for them to assist you.
Use the
so at that point in time, you can actually make use of the individuals, the passerbys, the people watching to actually, although nowadays I don't understand the using our phone to that's something that people do a lot of things nowadays. When people are actually dying, instead of it to actually go out there to help, we are using our phones and we are trying to capture the moment. Please, that's the reason why we say we are appealing to you to actually support. You see someone who is in need, the help we're asking for is that you show your maximum support. Not just support, actually protect these persons when they need help. Sometimes even in the face of great danger, they might just need an assistant. Okay, please, let's just into your house, into the front of your store, they are just there to actually help. They are not your enemies. We're not the people fighting you. We're not there to drag anything with you. They are here to actually help just anybody at any given point in time that needs help. So hospitals need to be protected. People need to be protected. The personnel need to be protected. The stakeholders need to be protected. So we're appealing to the individuals who are out there to show us their support and also protect us whenever we need their protection.
So, Mr. Anthony, you said something, and I wanted to give you a follow-up question to that. Okay. When you gave an example of when you had your personal experience where there was an accident scene, and thank God you were there because you're a Red Cross and you've been on the field, and you have actually been trained to help with at least the least of it is first aid. But for a situation, somebody like me that has no idea of first aid, how do I go about helping people in that kind of situation?
In that kind of situation, there is something we call do no harm. Do no harm means if you don't know what to do, please don't do it. Because in the area of trying to even look for a solution to help, you can worsen the situation. But I will help you. Now, if somebody is unconscious, lying without breathing, there is what we call recovery position. Recovery position. You're going to lie the person, and then the face down, then the leg somewhere, so that the person will recover, depending on what is happening to the person. If you see to that this person is excessively bleeding, the first point of attraction, stop the bleeding. If that bleeding is not stopped, please, the person will bleed to death. The first point of attraction, when you go out, this is what we do, order of priority. You go out to a mass casualty incidents, check around. The person that is shouting, my hand, my hand, my hand, he has the strength to shout. There's still strength, so much vigor. Just forget that person first. The one that is lying unconscious, lifeless, that is the first point of call. All right? So now when you get there, if it is unconscious without breathing, two, unconscious breathing, unconscious without breathing. This is how you check all these things. If I have time, we're going to demonstrate them. And subsequently, we can demonstrate the practicals later, not today. So check the first ones unconscious. Put them in recovery positions. Quickly call for help. Transfer them immediately to health center, the closest at all. Number two, if there is any form of bleeding anywhere, is it on the head? Anywhere, improvise. Even if you need to tear, you're wearing a long sleeves, you need to tear it and then remove it. Try it. Make sure it doesn't bleed anymore. You'd have to do it. Look around. Is there any clothes, any bandage, or anything at all? Even the person's clothing, But you do it in such a way that you don't expose the person, leave the person somehow. So use anything within your reach, handkerchief, anything within your reach. If it is dislocation, use the person, make sure the person holds the hand or the leg, doesn't move. If it is the brain, the spinal cord injury, don't move the person anyhow. It's just tactical ways of preserving them. So like you said, people that have not been experienced, you've not been on the field, you just saw it, you want to go and help. You really have to be very careful so you don't go in and worsen the situation. But first thing, like I said, tackle the bleeding, tie it, mobilize it. If it is the leg injuries, try and position them well. If it is spinal cord, don't move them anyhow. Call for help. As soon as you see this, I think 112 is road safety.
Yes.
When we finish, I'll just give you toll-free lines from Red Cross too.
Okay.
Yeah, so, and then you call for help.
You know, one of our major problems in Nigeria is being able to access instant and fast help.
Okay.
You know, you call it toll-free line and it takes almost an hour before they get there.
Oh my God.
You know, and that's actually one of our major problems, especially when it comes to emergencies in the country. You know, you at the moments when you need instant help, you're not able to get it. What can be done about this?
Okay. Right now, we've improved. I understand that it's something that we all are experiencing,
yes,
especially in Nigeria, but we have improved. We have numbers that work. We have fire service number that works.
Mm-hmm.
We
Fire road safety is also there.
road safety numbers that work.
Yes.
We have
Red Cross. Please walk
numbers
well.
that know. Yes, we've collected all that. We'll have all that for you here to share with you. So we have numbers that work nowadays. I know those are those times. So I know that people have actually lost that trust because of those times.
Yes.
So please regain it back because we now have things that work. We have phone numbers. We have people that you can always reach out to. And it's actually something very good to have in your house as a family member of a house.
First aid box.
You come to, not first aid box I'm talking about, you come to one side of the house, always have emergency numbers.
Oh.
Write it,
now we do it on one side of our house where anybody can have access to it. You have a police person's number, have fire safety, security, just have these contacts. Sometimes we don't see the need for these things until when there is an emergency.
And we start running
then you will start asking your neighbor who has this number. But in the time when you will start checking and walking up and down and looking for, time is going. Disaster, like things are actually getting worse. So it's very, very important that you actually have these things handy. Have your first aid kit, like you mentioned. Know what to do with them.
Not just having it.
Don't just have it. Yeah, some people just have it and hang it there.
Yes.
And they don't know what to do with anything inside. So know what to do with them. Have the contact of a police officer, a doctor. Have a contact of a road safety. Do you understand? Have those important emergency numbers by your side. Have toll-free lines. And let it be accessible to everybody. Not just the way we advise to always have an exit door.
Yes.
Have these things.
Those are our exit numbers.
Exactly, those are our exit numbers. Yeah, so those are emergency numbers that you should have. Your children should know where it is. Your wife should know where it is. Every member of the family should know how to access it. And then just a little basic knowledge about first aid. I wanted to just share something that happened to someone I knew. Although it was a robbery incident, and then he was shot. The father of the house was shot. So I know before they had to go from, and it was in the night, before they had to go from one place to another and
go and come back.
Yes, they lost their life. And it was something very appalling. But then, the children didn't have a knowledge of how to control bleeding. Because he was shot on the leg, and you know when you're carrying the blood is dripping and you're moving the person from one point to another. But if they knew, I had an understanding that you just had to part that surface,
put pressure,
and then tie it very well to hold it together, the blood would clot together. And it will help you at least before you get to where the person is not losing blood. So a little basic knowledge about just little and minute things as this is very, very important. So even if you don't have the technical know-how on how to, it's good that every family have a basic knowledge of these things. It's just basic things that should help us preserve ourselves.
Yes.
So it's very, very
now,
important.
this calls for a sequel to this program,
Okay.
where we would have, where you can at least show the audience basic things that they can do when they find themselves in a situation like this. But this will be in a subsequent episode, yes, that would actually help, that so that when we find ourselves in this situation, we know basic first aid, you can do this, and it could also help as well. Ms. Anthony, what can you add to that?
Okay, from what she said, if you have an incident, you can't do it alone. Call for help, number one. Number two, the first thing you do, there is an order that we treat people, Dr. ABC, danger. Check out for danger. An accident is happening on an expressway, and you are a Red Crosser or you're a personnel just passing or anybody, you want to go and help on that same expressway, whereas other vehicles are coming. Danger.
Casualty.
So you don't want to be a casualty too. What do? Use the passerby, the people around, delegate duties. At that point, somebody should just own it up and then act. Please, can you stop the traffic? Can you take care of this? Can you take care of this? So that you all work together and then transfer. As fast as you can, call for help. You will not do this alone, trust me. If it happens, you won't even know where to start. So when it happens, the first thing to do, remember, call for help. 2, danger. Check out. You must be safe first. Should anything happen right now, before she will even come to help me, this clothes must be taken away because I'm no longer I'm a casualty. So you have to look out for danger. If it's not safe, please, it's no need to have 2 casualties. Don't go in and become the second one. All right? So call for help, use the people around, then you can also help out.
Also, you said you're going to call out the toll numbers for us. Yes, you can help us with that.
We have the media handles also, and for MTN, we have 0803 123 0430.
Okay.
For Airtel, we have 0708 060 1149. We also have for Glow 0705 699 0020. Then lastly, 9 Mobile 0809 993 7357. The media handles for Facebook, just Nigerian Red Cross Society. You're going to see us on the Facebook. For Instagram, Red Cross Nigeria. Then we also are on YouTube, Nigerian Red Cross Society. You check that up. Then our office is at plot 589 TOS Benson Crescent off Ngozi Okonjo-Iweala by Otako District. That's the head office for Nigerian Red Cross. We also have the branch office, which we're coming out from. It's a DBM Plaza, Worcester Zone 1. So, but
316B.
Yes, 316B. So we are at the branch office. Anytime, any day, call us. Any questions, we'll be there to answer you.
Okay.
Thank you
so
very much.
the numbers you just called out are toll-free, yes?
Toll-free numbers.
Okay, that's great, because, one of the things that people are wondering is, if I call this number, my credits, so, But it's good that they're toll-free, and people can actually always call when they find themselves in emergencies, and it would help. But before we round it up on the program, I'd like you to give us a few words of advice to the audience out there.
Okay, so to my wonderful audience, I want to lastly say that we are here to help. We are here to support Nigerians. Please. We too are Nigerians, and we are here to actually support ourselves. So in doing this, we cannot do it alone. We need your help, we need your support, and we need you at every given point in time. So we're pleading that you Assist us when we need your help. Assist the health sector. Assist the stakeholders on the field. Assist the doctors and the nurses. Assist the volunteers when you meet them on the road. Please, at every given point in time, we're not there to force you to do anything. We're not a law enforcement agency. We're not standing, we the Nigerian Red Cross are not government. We are independent and we're impartial. So at every given point in time, we're here to work with you. Feel free to walk to any of us to discuss anything. Feel free to visit our office. Feel free to contact us at every given point in time if you have any question or whatsoever issue cut across, not just what we're talking about alone, both in healthcare in danger, both COVID-19, both in any sort of gender abuse or whatsoever the case might be. But just feel free to always access the health sectors, and then the sky will just be a starting point.
Well, thank you very much, Ms. Joy. And Ms. Anthony, what would be your last words?
Okay, thank you very much. I'm really so happy coming here to share our views. Number one, I want to give an open invitation, even unto you, Ms. Lois. Please, do well. Come and enroll with us with the Nigerian Red Cross.
Okay.
It pays to serve. Come on, it gives me the happiness to help. Trust me, whatever we're doing is volunteering. I don't get paid doing what I'm doing. Like I said, the accident that happened some time back, I had to stop my own taxi. Help. I said, Oga, no, go and leave me. Because I have to do the work that gives me pleasure. So I want to call on everybody out there. Feel free to come and join us. Volunteer your life, your services, aside from other works you're doing, to serve humanity. The knowledge you will gain, you can use it for your family and friends. Trust me. There are some domestic accidents on the way that could be coped or preserved, that could be taken care of. But because we do not have the necessary technical know-how. So, but if you come and join us, you go through a series of trainings. We won't charge you as a member. And also, I want to encourage us, all stakeholders, everybody, let the hands be on deck. Let's try and preserve health personnel, facilities, ambulances, or everything within the health sector. Because that's where we go and access wellness. So if these things are destroyed, then where do we go? And I also want to use this opportunity, if you have not gotten your vaccination, please go get vaccinated. COVID is real. You have to go get vaccinated. Thank you very much.
Thank you very much, Mr. Anthony and Ms. Joy, for taking our time to be here with us on health and well-being, and to also enlighten us on quite a number of things. We have been very much well enlightened. Thank you very much.
You're welcome.
Well, that's the size of our podcast today on health and well-being. Do remember that we all have to put hands on deck to make sure that we safeguard our healthcare system and our healthcare personnel. Do keep it to date with us same time next week. I am Lois Abasambo. Do stay safe.